I'm Armin Brott with Men's Health Network and talking with Gary Thompson from Alameda County Health Department. But that's just like the beginning of it. Give us a quick synopsis of who you are and the great things that you're doing.
Well, thanks, Armin. As Armin said, my name is Gary Thompson. I'm with the Alameda County Public Health Department, and I'm the program manager for the Family Health Services Fatherhood Initiative. I'm also the co-founder of the Alameda County Fathers Corps.
Alameda County, for those who don't know, if you are not a sports fan, Oakland is the center of Alameda County. So tell us about we're here at the conference of the National Healthy Start Association, and I met you last year here, and we've talked a little bit since then. But you've been coming to these conferences. Tell us about what are you learning here, first of all?
Well, this is one of those conferences I really look forward to every year. It's the National Healthy Start Association Conference, and one of the reasons why I really appreciate coming to this part of it, this is the summit on fatherhood. I think it's health and wellness for men and boys. And one of the things that I really appreciated, this is something that acknowledges and affirms the importance of fatherhood. And it's a national conference, which means people from all over the country are coming to participate in a dialogue around fatherhood and the importance of father engagement and really how the importance of the fathers and their families. You know, the National Healthy Start Association and Healthy Start is really focused on addressing poor birth outcomes and infant mortality. And now I think there's a recognition that fathers have not always been in that conversation. So now this work is really about making sure that people are listening to that, but also creating programs and services to support the fathers in that context.
Well, the conference is about fatherhood and health, men's health, which is an interesting part of it, which is it's certainly consciously there, which is a very important thing. And we were talking about this at various points too, that the whole part about fathers' impact on their children's health and then their children's impact on the father's health as well.
Absolutely. I think you're absolutely right, Armin. I think one of the important factors is that sometimes services sometimes seem to be compartmentalized, and we really need to look at the spectrum of what fatherhood means, and being father also means being healthy. And there's evidence and research that shows that if a father's actually engaged in their child's life, there's a sense of wellness, a sense of responsibility and well-being that comes from that. And I think that has a direct correlation to physiological health as well as mental health. I also think in terms of men's health that we really need to engage men in talking about reproductive health too. Men play a role in having a healthy birth outcome, and that's not just when the baby's born. It's also taking care of yourself if you are about to have a child as well.
Right. The preconception part of it is thinking about whether you have the child at all, or when and how you're going to be able to support this child, because so many people go into it for either no reasons at all or the wrong reasons, and understanding what you got on the other side of that baby.
Absolutely. I mean, think about it this way: when you think about conception, contraception, obviously there are things that men can do, but we're not always engaged in family life planning, and I think that's another aspect that we can actually fold into this work. When we talk about including fathers, we also need to think about how can we have a conversation with young men about when is the right time to have a child. And I think these are the things that are being discussed here as well.
One of the things that I find so wonderful about the work that you're doing in Alameda County is that you've really been able to make some inroads in getting not just your own little area, your own little kingdom of fatherhood to be recognized, but you've produced a document which shows the other agencies throughout the county about how they need to be more father-friendly. Talk about that.
Right. Well, that's one of the things I'm really passionate and proud of, is that I oversee some direct services. We provide direct services, one-on-one services to fathers. But I'm also involved with capacity building of other agencies and nonprofits in our county through the Alameda County Fathers Corps, which I co-founded with another colleague. And the whole purpose of that is to build the skills of other male service providers to serve fathers more effectively, but also to really engage systems like healthcare and social services, probation, and child support to become more father-friendly. And what would that look like in those particular agencies? So we've actually developed 7 father-friendly principles. We've done some practice-based research that really speaks to the issues that fathers face in Alameda County, and we've used that information to create, recommendations for action and change. And we've gotten the support of the elected officials in Alameda County, particularly the Board of Supervisors, who've adopted them formally, and now we've been implementing through training and actually hands-on practical ways to address these issues, but in these different settings such as, the different public systems as well as the CBOs. And there's a lot of interest in doing this because I think people are really looking at the family from both sides of the coin, the mom and the dad. And traditionally, those services have always focused on mom, and there's now this, real conscious, recognition of affirmation that this needs to happen, and we're helping them change the system in a way.
Well, Lee Warner from the CDC just a few minutes ago was talking about how in a program called PRAMS, which is very wide, it's been out there for a number of years, how the only question that they had in there about fathers was to the women was something like, when was the last time the father of your children hit you or slapped you or something. And I mean that talks a little bit about what you're talking about with making the other agencies father friendly, is recognizing that this kind of a question may serve a purpose, because yes, domestic violence, we need to talk about that, but if you want to get guys involved, you're going to have to say, when was the last time the father of your children came to see the kids, and what did you do to help him do that?
Well, I think what that speaks to is about changing the narrative. It's not just changing how we work with fathers, but also change about how we perceive fathers. I think many times, particularly fathers of color, are perceived as not being interested in being involved with being involved with their children. That term deadbeat father is something that most people recognize, or baby daddy. But what research and also what we have found over the last few years that we've been doing this work in Alameda County, almost everyone we talk to, they want to be involved with their child's life, and there are barriers, sometimes systemic barriers, as to why they're not there. And I think if
you want to get welfare benefits, there has been historically a need to have the father not living in the house.
That is something, absolutely, but I think we're seeing these systems now looking at those issues and saying, how can we be more father-friendly? Because if we want really to have successful families and thriving children who are prepared, we recognize that you need to have both fathers and mothers in these child's life. And I think this is what most systems are now starting to recognize, and now sort of how do you create a roadmap, and that's what the work we're doing. We're trying to assist these agencies to do this work more effectively and smartly.
What kind of pushback did you get, if any, on this? I mean, because there's a certain amount of upstream swimming that's going on here.
Absolutely. I think the initial pushback is that why? Why would you do this? We really need to focus on moms and children. Well, I think it's because this is what we've always done. Historically, we've done services that are focused on mothers and children. Now we're really trying to change the paradigm. We're not saying it's an either or. We're saying it's about an and. It's about inclusion. And when you explain it to people like that, there's sometimes a light bulb goes off, a switch goes off, and say, okay, we can do these things differently. But you really have to build capacity. You have to actually address some of these issues when professionals particularly, are in training situations, going actually to schools, going to high schools, middle schools, as well as the local universities, to talk about how you can, infuse this work into training, so when professionals come in the field, they can look at both the whole family intact, as opposed to just sort of focusing on a discipline that focuses on mom or child.
Yeah, well, that's such an important thing. I mean, that's pushback that I get sometimes too when I'm talking about fatherhood, is you're trying to take something away from women and say, no, you know what? You have to understand that by helping fathers be more involved, we're helping women, and we're helping the children, which is really what the whole thing is about, right? I mean, we're looking for healthy families, not just healthy women or healthy babies or healthy fathers, is that kids thrive better than they do otherwise when they have a mom and a dad who are involved.
Absolutely right, and that's our motto in terms of, if you have a healthy father, the healthy father, creates healthy situations for children, as well as healthy relationships with their partner, and that's a thriving community, a healthy community as well.
Gary Thompson, thanks so much.